Knock, knock. Hand hygiene. Hi, Casey. My name is Sarah. I'm the nurse that'll be taking care of you today. Can you state your name and your date of birth for me, please? And we have Casey Banks, 10-2-1965, and I see Casey Banks, 10-2-1965 on your record. Do you have any allergies, Casey? And Casey says he's allergic to aspirin. Okay, I do see that on your wristband and on your medication record. All right, Casey, so the reason why I'm here today is because we're going to be doing a nebulizer solution. You do have that available for you for your shortness of breath. Are you feeling short of breath right now? And he says, yeah, I have COPD. Sometimes I get short of breath often. So we're going to do that nebulizer. It's going to make the medication, the albuterol, go into really small particles, and it's going to make its way into your lungs and help relax your airway muscles and allow the air to move better into your lungs, okay? So it does take about 10 to 15 minutes for that to be completed. You have to go to the bathroom before we get started. Casey says nope, he's good to go. So I'm just going to get you in a position, do a couple of assessments, and then we will get our medication prepared and equipment assembled, okay? All right, so we're going up to 65 degrees for the head of the bed. And I'm going to get my pulse ox on. So I have my alcohol wipe here. I'm going to select a finger that does not have any nail polish on, checking that it's warm. We have capillary refill, less than 3 seconds, and there's no swelling. So I'm just going to wipe your finger off, Casey. It'll feel a little cold. All right, that's cleaned off. I'm going to put this monitor on. It just shows me your oxygen level and your heart rate here. So that is on. It's going to correlate with the pulse. So I'm palpating your radial pulse for 15 to 30 seconds. And so far it is matching up with our monitor. Your oxygen reading is 90%, so it is a little lower than we like. We like it to stay above 95%. But your heart rate is within normal limits. It's in the 70s. We want to keep an eye on that, because this form of albuterol can increase your heart rate and make you feel a little bit jittery. So if you do feel like that, that is an expected side effect of the medication, all right? So we did that, and I'm just gonna take a listen to your heart and lungs here. I'm looking at the respiratory rate, rhythm, effort. It does look like Casey's having some shortness of breath and labored breathing. We're gonna take a listen here. All right, Casey, your lungs do sound pretty wheezy, but this medication should work. It's going to go down deep into your airway passages and help open it up so you can breathe a bit easier, okay? Do you have any pain before we get started on a scale of 0 to 10? 10 being the worst pain, 0 being no pain, and Casey says he's at a 0. He does not have any pain. So we did our pre-assessments. I'm going to get our medication checked, and we'll check our package integrity for our nebulizer equipment as well. So I have Casey Banks, 10-2-1965, allergy to aspirin. We have an order for albuterol sulfate. I have albuterol sulfate inhalation solution. This is an inhalation solution, 0.083%. This is 0.083%, 2.5 milligrams per 3 mLs, and I have 2.5 milligrams per 3 mLs every 4 hours as needed for shortness of breath, and it was not given today in the last 4 hours. This does not contain aspirin. It's not expired. So Marcheck 3 is complete for my nebulizer solution. I have my nebulizer equipment here. If this was new packaging, I would make sure that package integrity was intact and that it is not expired. But I have one that has been used before, so I'm gonna do my hand hygiene again and get my gloves on. So Casey, I'm gonna demonstrate to you how we put our nebulizer equipment together so that when you go home, you know how to do this yourself, all right? So when we take this out, we're going to have a long tubing here. This is going to connect to the compressor if they are not on oxygen. Or if they don't have a compressor, we can use medical air. We have to be at least 6 liters for that to work. If they are on oxygen, you can use the nebulizer machine on top of it or use a separate mask for that. But we'll go over that in class. So I have my tubing here. I have this blue tube. We're going to have a part that looks like a T. We're going to connect this here together like that. And then there's going to be a mouthpiece section. So the mouthpiece is going to go on to this end. So it'll look like this. And we're going to have a couple more pieces here. Oh, dang it. Okay. So of course if that happened, we would get a new set. So there's going to be a little cup. Yours might look a little different based on the manufacturer. I'm going to put that little blue part in. That's going to help with aerosolizing the medication. And we're going to set that aside. I'm going to connect this lid to that little opening there. Okay. So I'm going to open up my medication and we're going to pour it into our nebulizer canister. So I'm twisting off the opening here without crossing over. And I'm going to empty this into the container. I don't want to touch the tip of the nebulizer medication cartridge to the plastic. I'm just slowly putting that in. We don't want to go too fast, otherwise it could splash and then we'll have wasted medication on the table. So just putting that in until it's all in there. And now I'm going to screw this top on like this. So it should look like this once we get the medication in. Now here I'm going to connect this to my tubing. So I'm going to connect this to the output system here. Okay, and we're going to turn it on. So I'm turning on the compressor. I'm testing the flow, before we hook it up. We've got it hooked up now. And I see that the medication is starting to aerosolize. So Casey, I'm going to have you place your lips around the machine. The compressor would still be on. I just turned it off so that you guys are able to hear me better. So they're going to inhale slowly and exhale deeply through their mouth. And as they do that, they're going to be inhaling that aerosolized albuterol. They're going to exhale through the mouthpiece. And we're going to continue this until the medication is all gone through this container here. So you'll see that slowly it starts to decrease in the volume, and that's because of it aerosolizing into the air and into Casey. So once we have just a few particles left, we're just going to tap this and make sure that all of the bubbles get down, or all of the droplets, so that he gets all of the medication to help with his symptoms. And we're going to go for another 5 minutes here. All right, so Casey's done. I would turn off the compressor at this point and disconnect my equipment. I'm going to set this aside for now. Casey, now that we've done that nebulizer, I'm going to have you just rinse your mouth out for me, okay? So he's going to rinse and spit. Okay, so Casey rinsed his mouth. I'm going to then reassess lung sounds, respiratory rate and rhythm, the pulse ox readings. So listening to lung sounds here. Okay, so Casey, it does sound like there are diminished lung sounds, but there's not as many wheezes, so that is an improvement. And we're checking your pulse ox again. We left that on during the nebulizer, and your reading is about 95% now, and your heart rate is in the 80s, so it went up a little bit, but not too much. How do you feel right now? Casey says he feels pretty good. There's no jittery feeling. So I'm gonna come back later, and in about 15 to 30 minutes, we'll be able to reassess your lung sounds again. Once this medication continues to keep working in your body. So we're gonna clean our equipment. It can get stored in a specific bag after it's been left to air dry. Weekly, you'll wanna clean this out with soap and water or a vinegar solution just to make sure it's clean and free of debris. So once it's clean and dried out, we can store it into this bag for the patient. That way it goes along with them wherever they go in the hospital. So last but not least, I'm going to document that we gave this medication. Always in military time, an initial, and we sign off. So Casey, again, I'll see you in about 15 to 30 minutes. Casey's got his call light, bed is in the lowest position and locked, and side rails would be up.